Hi, my name is Ekta. I'm a nurse here at Nyack Presbyterian Hospital. Been working here for about 3 years, and I'm going to talk to you about this fairly new machine that we have on our transplant unit. It's called a bladder scanner, and what this machine does is, once you turn it on, you can actually use this probe, and you can put it over the patient's bladder, and it will give you a very accurate measure of how much urine this patient has in their bladder. So when you want to start, the first thing you would do is get to your main screen. You have a selection of either male, female, or child, and this does make a difference because depending on the sex and if it's a child, your anatomy is a little different, and the machine can actually pick that up. So you choose what the sex is and whether it's a child. And the only other step you have is to really put this machine on where the patient's bladder is. Make sure you use some jelly to make the visual field a little better. You place your probe on, and it's a simple matter of one click, and it will sense how much urine you have in the bladder. And actually, I can do it and show you what shows up on the screen. You won't see anything in there. But you see, here it's showing me that I have 0 milliliters of urine. If there were to be urine, you would see a yellow, almost like a yellow coloring in here, and you would see how much urine is in there. And a lot of times we use this because back in the day when patients would not urinate, we would have to make them go through this procedure of putting a Foley in them, and sometimes they wouldn't have any urine in there. So this avoids having us make our patients go through that, so we can know what it is before we even take any action. If there's no urine, we save them that misery. Another thing is that it's not painful at all. It's very comfortable for the patient, and it's so quick. So it's a very great machine that we have on this unit to avoid sticking catheters into our patients unnecessarily, increasing their chances of infection and the pain and trauma and bleeding and all the number of things that come with it. So, there you go.
That's our bladder scanner.